Statistics, causes, signs, and more about suicide. 1. Suicide is more likely to happen to men. According to suicide data, 79% of all successful suicides are committed by men. However, women are twice as likely to suffer from depression than men, and they attempt suicide 3 times more frequently than men do. A suicide attempt by a woman typically involves poison. 2. The 8th leading cause of death in the United States is suicide. Nearly 40,000 individuals die by suicide each year, making it the 8th greatest cause of death in the majority of age categories. Every year, an estimated 250,000 people report having survived a suicide attempt. 3. Many well-known people have made suicide attempts. Celebrities can suffer from depression or commit suicide. Well-known celebrities who took their own lives include Kurt Cobain and Robin Williams. Britney Spears, Halle Berry, Frank Sinatra, Elton John, and Ozzy Osbourne are among the famous people who have made unsuccessful suicide attempts. 4. Youth suicide rates are on the rise. For teenagers and young adults between the ages of 15 and 24, suicide ranks 3rd in terms of likelihood of death. For kids between the ages of 10 and 14, it ranks as the 4th most likely cause of mortality. Watch out for issues at home, in school, or with any kind of substance usage. 5. Soldiers have a high suicide risk. The epidemic-like nature of the issue has been described by numerous officials as a result of the rising suicide rates among military personnel. The suicide rate in the Army National Guard was 30.8 per 100,000 in 2012. The rate was 22.7 per 100,000 for those serving in the military on active duty in all branches. 6. Suicide was promoted in Indian culture in the past. According to suicide statistics, Hindu wives in India were frequently expected to take their own lives. She was supposed to toss her body upon her deceased husband's body, which would be burning on a funeral pyre, once he passed away. It was believed that doing this would ensure that she would accompany him into the next world. Despite the fact that this practice was outlawed in 1829, there are still a few isolated instances each year. 7. Brain activity may be related to suicide. According to research, serotonin levels are thought to be a potential indicator of suicidal thoughts. 6 times as many persons who have low amounts of this brain chemical attempt suicide as those who have higher levels. 8. One can prevent suicide. Most suicides can be avoided if friends and family are aware of the warning signals and take the necessary precautions. Withdrawal from relationships and activities, mania, violence, nightmares, and excessive restlessness are all indications of depression. If someone you know is discussing suicide, get them immediate professional assistance. 9. Suicide attempts have been illegal since. A number of laws have been created that make it unlawful to attempt suicide. Even though the majority of nations have already repealed these laws, those that still exist in areas do not usually punish. The person may be admitted to a mental health hospital for assessment and treatment if they attempt suicide in the United States. 10. Most suicides with guns are suicides. Nearly 60% of suicides include the use of a firearm, which is more frequently utilized by men than by women. All firearms should be removed from a home if there is a resident who poses a greater suicide risk than usual. 11. Antidepressant medicine can be beneficial. Suicide is most frequently caused by depression. The likelihood that someone may commit suicide can significantly decrease if they seek therapy for depression. Antidepressant medication has been found to reduce the signs and symptoms of depression. However, additional care, such as counseling, will be required if a person has suicidal tendencies. 12. Children of suicidal parents are at a higher risk. According to some studies, a child who has a parent who commits suicide is up to 3 times more likely to make an attempt on their own. In general, family members may have an effect on suicide chances. Adults who have been divorced have a 3 times greater risk of suicide than married people. 13 to 4% of adults have considered suicide. Adults who have thought about suicide on a serious level are included in this statistic. They might read about it and daydream about it. Fortunately, fewer than half will actually try, and even fewer will be successful. Suicide is most commonly caused by depression, which may account for 75% of suicides. 14. Suicide rates rise in the spring. A prevalent misconception about suicide is that it tends to happen more frequently around the holiday season, when people may be more impacted by the absence of family members or financial difficulties. However, between March and May is when suicides truly peak. Suicides increased by 5% on average throughout this time. In fact, suicide rates are lower than typical around Christmas. Also, some days are more typical than others. The days with the highest and least suicides are typically Monday and Saturday. 15 Youth is not those most affected. Many people think that young people experience despair and suicide thoughts the worst. The truth is that across all age groups, seniors have the highest prevalence of suicide. Frequently, the risk of depression in the elderly is 50% higher than in adolescents or young adults.